There's something called the nocebo effect. So the placebo effect is the power of positive expectations. Like if you think you're going to get better, you're more likely to get better. The nocebo effect is the power of negative expectations. And that can go along with, so you have this diagnosis and you're like, oh no, I'm sick. There's something wrong with me. I'm going to have this for life. And or maybe I need a medication to deal with it because I have an illness, therefore I need medication. So the nocebo effect, can go along with kind of tying yourself to diagnoses, which again, it's very easy for 20-somethings to check these boxes. And many of them will not meet criteria for these disorders in 2 years or 5 years once their lives have improved. They'll feel less anxious on the outside. On the inside, they're more competent on the outside, so they're feeling less depressed, they're feeling less anxious. They get better study habits and organizational habits in college, and then, it's like, well, maybe I don't have ADHD.
Welcome to No One Knows What They're Doing, a show where we talk about how no one really knows what they're doing. We're all out here winging it, making it up as we go along. I'm your host, Erin McGough. Today, I'm joined by a very, very special guest, Dr. Meg Jay. Dr. Meg Jay is a developmental clinical psychologist who's been specializing in 20-somethings for over 20 years. She is the author of Supernormal, The Defining Decade, one of my top recommendations for anybody in their 20s, and her brand new book, The 20-Something Treatment, A Revolutionary Remedy for an Uncertain Age, is now available everywhere. Her books have been translated into more than a dozen languages, and her work has appeared in the New York Times, Wall Street Journal, Harvard Business Review, and on NPR, BBC, and maybe the most important for her audience, TikTok. A recent New York Times profile called Dr. J the patron saint of striving youth, and her TED Talk, Why 30 is Not the New 20, is among the most watched to date. Dr. J earned a doctorate in clinical psychology and in gender studies from the University of California, Berkeley. She is on faculty at the University of Virginia and maintains a private practice in Charlottesville. Whew. All right, Meg.
That's a mouthful. Yeah.
How are you feeling today?
Great. I'm always happy to see you, Erin.
Oh, me too. Man, I mean, it's just so crazy to think about when I was back in college and my sorority sister recommended The Defining Decade to me.
Oh, I love it. I don't know if I knew that.
Oh, yeah.
I love that.
I was in college.
Okay, good.
And,
good timing.
Yeah, and I listened to the audiobook.
Nice.
So I listened to your voice on the way back and forth from school because I commuted.
Oh, cool.
And every day I was like, this is the kick in the butt I need.
Oh, nice. I love it. It helps delivered with a southern drawl. It helps.
Yep. I was like, anything this woman says, I trust. And congrats on the launch of your new book.
Thanks.
The 20-something treatment.
Treatment. Yep.
This is chock full of wonderful tidbits from the importance of learning how to cook.
Yeah.
Which is very important.
It is important.
You really make the case for that.
Good.
Making friends.
Yep. Also important.
I really love the part where you talk about you were working with somebody in their 20s, a 20-something, and they were talking about how it was just so much easier to make friends when they were younger. And you talk about how it wasn't easy. Other people just did the work for you.
Right.
Your parents set up play dates, and they took you to soccer practice.
Right.
And your teachers set you up. And I was like, oh my gosh, that's such a good point.
Yes, it's always required effort. It was just when you were younger, other people were doing it, or you were in a classroom with 30 or 300 people exactly your age. But, they're out there. You still just do it the same way you used to do it, which is go live your life, do what you enjoy, do what's important to you, and you'll meet other like-minded people.
So before we get started, I do ask every single guest the same question. And you are a heavily decorated PhD with many accolades, psychologist, author, speaker, and at the end of the day, Meg, do you know what you're doing?
Okay, I feel that I'm supposed to say that I don't, but let me say that I do, but let me say that I only do because I've been doing it for a pretty long time now. Mm-hmm. So I will 100% say I did not know what I was doing when I started. Now, there are certain areas of my life where I don't know what I'm doing. We all will appreciate this. Social media, I definitely don't know what I'm doing. So I have a social media.
You're doing a good job, though.
Well, see, I'm not doing it. I have a social media manager, and she's amazing, and she's in her 20s, and she knows what she's doing. So I know how to, pair with good people.
Yeah. Oh, that's great. Yeah, know your weaknesses and hire people to do them on your behalf. That is my strategy. Okay, great. So I want to do a little rapid fire round so that people can get to know who Meg is as a person.
Right. Great.
First question is, where did you grow up?
South Carolina.
Oh, I never would have guessed you're from the South. What did your parent or parents do for a living growing up?
I am a third-generation educator, so I'm from a long line of female teachers. I mean, I'm a sometime college professor, primarily a clinical psychologist, but I'm really an educator at heart.
Did you go to college, and if so, what did you study?
I went to University of Virginia, where I am back again on faculty. I studied psychology ultimately, but in a sort of I guess I did college maybe the way you're supposed to, and then I went in not knowing what I was going to do. I took a whole bunch of different classes, and then one day I realized, oh my gosh, I love my psychology classes, couldn't wait to do the reading, couldn't wait to go to class, went to everyone, sat up front, and then one day I had the light bulb moment of maybe I should stick with this and do that. So I studied psychology, but it wasn't like I've known since I was 10 that's what I was going to do.
Got it. Okay. What was your first job ever?
Okay, great question. My first job ever, but my first job I had in my 20s. Let's do that because that's as far back as I can really be accurate about. It's funny because I was actually had dropped out of college and was taking a gap year, which might sound really romantic and amazing, except I was, broke and took any job I could get, which was as a proofreader, which might sound really cool, but I was proofreading like names and addresses that had been left on like an audio thing. So all day, 7 hours a day, I listened to people read off their names and address, and I, proofed it. That was it.
Glamorous.
And it made college look amazing.
Yeah.
So I went back real fast.
You went back. You're like, I'm not doing
I could
this.
see my future without college.
Okay, and what is your current job?
My current role, I'm a clinical psychologist. I specialize in 20-somethings. My job is highly variable, which is awesome. So I see private clients. I work over at the university at student health, which I really love because you never know who's going to walk in the door. I write books. I go on lovely shows like this. I give talks. So the work that I do is very diverse, which I love.
So you work as a clinical psychologist. You're an author. You work as an active therapist. You have your own practice. For anybody out there who's listening who might be interested in getting into the field of psychology, can you tell them a little bit about a day in your life and your career and kind of the pros and cons of being a clinical psychologist?
Yeah. I mean, I would say a typical day when I'm practicing more like a typical clinical psychologist, not as like an author and a speaker and whatever, is you get up, you probably make your own hours. You generally choose your clients because clients come to you, but if it doesn't work or it's not a fit, it's not a thing. You don't, So you generally choose, the people who are on your calendar week to week. You talk to them about very important moments, days in their lives, about their goals, their hopes and their dreams and their fears. So, the work is very meaningful. I work with young adults, so it's both meaningful and highly impactful. It can be stressful because young adults can be a bit volatile. And so, in terms of the pros, I just love the age group I work with. I love the flexibility. I love the self-directedness. I love the meaningfulness of the work. I don't really feel any cons, which I guess means I chose the right job, although there is stress around working with people who are sometimes thinking about ending their lives or self-harming, that's not always easy to leave at the end of the day.
Yeah, and you can't fix everyone at the end of the day, too. I bet you have lots of people where you're just like, you need to want this, and that must be very heavy.
Yeah, it is. There's a joke, for lack of a better word, but it's, how many therapists does it take to change a light bulb? And the answer is just one, but the light bulb has to want to change. So, I'm only half of the equation at most. But even if the light bulb wants to change is not always easy and it's not immediate. And so, and sometimes, and the con of that it can be stressful is oftentimes my clients, anybody's clients need the most, nights and weekends when you're not around. And so, I think for me, therapy is a means to an end for my client, but shouldn't be, I shouldn't be the most important person in their life because I'm not there on nights and weekends.
Yeah, making a support system around them. So that's really great. So psychology would be a good career to pursue. And I know there's not just clinical psychology, but you can be a psychiatrist, you can be an academic. You've spread yourself out. So you're not just a therapist in your practice, but you're an author and then you work at the university as well, right? Was that a choice to did you need to do that or did you want to do that?
I came up through academia, so, I got my PhD at Berkeley, so I was definitely trained to be a professor and a researcher and a clinician. I loved the clinician part, so I leaned into that, started writing books. I don't teach anymore because it's, the most restrictive in terms of not being able to leave town or, whatever. But I still do go over to student health one day a week just because I want to, because the great part about that is you never know who's going to walk through the door. So I see a really diverse group of folks. Whereas in my private practice, you can imagine, people who seek me out, they already know what I'm about. So it's not really, a fully authentic interaction in that way. And, the other thing I love about it, and this really, has to do with the kind of work from home hybrid work piece, is staying over at the university keeps me in contact with colleagues that I really respect and keeps me thinking about things other than my own sort of small clinical world.
Absolutely. Mm-hmm. I'm the same way. I don't ever charge for a one-on-one call, but I'll give away free one-on-ones just because I like talking to people. Because, I live in New York City. It can be a little bit of a bubble here. Mm-hmm. People here tend to have higher incomes. They tend to lean more left. That's just how things are. And so I like to kind of get out of my bubble whenever I can and see what it's like to be a nurse in Kentucky right now.
Definitely.
And it can help me gain more insight into how the job market actually is and how people are feeling.
Right.
So I totally relate with you there. All right, so you are one of the world's leading experts when it comes to 20-somethings.
That's true. Well, there aren't many, but but yes.
You don't need to know that. There's tons. And something that I find fascinating about your research is that you study laterally and longitudinally, which is a hard word for me to say. Longitudinally?
Longitudinally, yes.
Longitudinally. There we go. Mm-hmm. All right. So can you tell us a little bit about what that means?
Yeah, so I study 20-somethings, 18 to 35, because I don't like hard cutoffs, but generally the 20-something years, and I've been doing that for about 25 years, so it's not just Gen Z. I'm a Gen Xer. I started working with 20-somethings right after I was a 20-something, so it's really started working with Gen Y, millennials, and then now there's Gen Z. And so I'm not, I've been looking at it across a period of time, not just in this moment.
So you study 20s, people in their 20s right now every year, and then you study people in their 20s as they grow up and get older.
Yeah, so, we also know what happened to those 20-somethings from 20 years ago, and the news is good, so I could go ahead and do spoiler alert that in general, people hear that their 20s are going to be the best years of their lives. Empirically speaking, not true. Thank goodness. I tell my clients, if your 20s turn out to be the best years of your life, something has gone terribly wrong. So ideally, what you want to be doing in your 20s is, yes, enjoying them, but also sort of putting in the work so that what comes to fruition in your 30s, 40s, and beyond gets better and better. I mean, people tend to be happier, healthier, more successful, more emotionally stable. Their relationships are more solid. It really is all up from here in a good way.
Yeah, that's such great news. I love how your book has that optimistic spin. It's almost like a gut punch at first to hear that your 20s are not going to be the best decade of your life, but then you say, and here's why that's a good thing.
Right.
And here's the data to back that. That's not just you spitting out what you think is true, but here's the data to support it. Decades of data.
Yeah.
And so you also talk about how 80% of the defining moments in our life happen before we hit 35. Can you tell us a little bit more about that?
Yeah, so this comes from some really interesting research from people, towards the end of their lives, and they, looked back at, figuring out career, finding partners, deciding on a city, meeting those important people that really had a big impact. And 80% of those moments happen before age 35. The other piece I like about that is what they said was that those moments weren't like these giant, fireworks moments as much as, oh yeah, I started that degree in whatever, or I met that person who introduced me to whoever. And so oftentimes it's small 20-something moments that end up sort of being defining. We just don't know it at the time. And so, a metaphor I use a lot is working with 20-somethings, like working with planes after takeoff. A really small change in course can have a big impact on where you end up. And that's one reason I love working with them is, it's, I don't want to say it's easy, but from their side, some small maneuvers can make a really big deal.
Yeah, it's interesting. I get loads and loads of DMs and emails and messages, which I very much welcome, and I read all of them. I can respond to only a few, but they give me a really good insight into how people are feeling, and in this moment, in this year, in this point in time. And something that I've been noticing a lot in the past 12 months is young people are feeling very directionless. They say, I don't know what I want to do with my life. And that's always been a common sentiment from 20-year-olds. But right now, there's a certain sense of almost like a apathy. And they're like, I don't know what I want to do with my life. And I also don't really want to put in the effort to figure it out. So I'm just going to do this. What would your advice be to someone, who came to you and they said, I don't know what I want to do with my life?
Well, I'd say, well, what do you know so far, or what are you thinking, or what are you trying, what are you doing? That usually people don't figure out what to do with their lives by talking to me or talking to other people. I mean, to some extent, self-reflection is useful of like, well, I did this and I didn't like it, and I did this other thing and I did like it, or I was really good at it. But, beyond that, the only reason you have those bits of self-reflection is because there were boots on the ground, there was, data gathered at some point. So I would encourage the person not just to talk to me about it, but to say, well, what can we help you get out and do so that you can figure out what it is that you might want to do and be good at. I mean, most people have to do something, unless you're, a trust funder. Even still, even people who have money are happier when they work. And so, as a matter of fact, work is like the leading source of positive change for young adults. So when I talked about life gets better across your 20s and beyond, work is the biggest driver of that. So no matter what someone's circumstances, I'm always trying to help them find a meaningful occupation. What do they enjoy doing? What are they good at? What pays the bills? What works for them? Because in general, that makes people feel happier and healthier.
Yeah, that's so funny. I say all the time, unless you are a trust fund baby, a sugar baby, or a normal baby.
Just a baby.
Just a normal baby,
yeah.
I guess. You're going to have to work in your life.
Right.
And that's the way it's always been for all of humanity,
right.
and will probably always be for all of humanity.
Right. So you might as well like it.
So you might as well like what you do.
Be good at it. Mm-hmm.
And you're going to spend a huge chunk of your life working. So if you hate what you do, you're apathetic towards what you do, you're just going to not enjoy a big chunk of your life.
I mean, I think that the tricky part is, and I, absolutely remember this myself as a 20-something, is, you just said you're going to have to work in your life. And I do think 20-somethings are like, oh, God, I have to work. Where I am in my life, I like working. I wouldn't stop working. And so I get to work. I like to work. I choose to work. Even if I could stop working, I wouldn't. But I didn't start off like that. It wasn't like that my 20-something job was so amazing I couldn't wait to do it, because it was not on my terms. The pay wasn't great. My bosses weren't amazing. You're not going to have your favorite job in
your 20s.
Right. And so it's sort of like you have to kind of stick that out to get to a place where the work feels good and you're excited about it. So I wouldn't say your 20-something jobs are reflective of whether or not you're going to be excited about working 5 or 10 years from now.
I always tell people your career only gets easier as you get older, unless you have huge interruptions that, for the average person, it's going to get easier. Job interviews are going to get easier. Asking for a raise is going to get easier, not only because you've done it before, but because you have reasons to back it up. You say, I've done this, I know how to do this, and you naturally gain more confidence. I do have a more optimistic approach towards careers because I frankly just think it's a waste of time to have a negative approach because it's inevitable. You're going to have to work, so why not figure out a way to make it enjoyable? And my mindset is, for all of human history, 99% of the time we've been on Earth, humans' job was farm. Like Ken's job was beach. It was like humans farmed and gathered and hunted and birthed and sowed. And now in 2024, we have an opportunity to choose a career.
Right.
The word career is like actually relatively new to humanity. And the economic mobility that is like available to us now when you zoom out is like absolutely unheard of in human history.
Right.
The fact that if you have access to Wi-Fi and a computer, you can gain a certification that can make you qualified for a job paying $20,000 more than your parents ever made.
Right.
Like that was never a thing before.
Right.
So I have more of an optimistic
Good
approach.
for you. I think that's fantastic. And absolutely true. I mean, this is sort of making me sound old, but as a Gen Xer, when I was in my 20s, if I wanted, now people are going to die now, but there was no internet. So if I wanted a job in New York, I know it was kind of amazing. However, when you wanted a job, you literally walked around and walked into places and shoved your resume in someone's face. That's literally how you did it. And so it was very limiting. And, you could look for a job in your town. Or if you wanted to sort of be brave and move to New York, you had to move there with no job, which made that very difficult for most people to say, I'm going to move to New York with nothing in hand. So anyhow, there are many upsides to being a 20-something in the 21st century.
So many pros and cons. I mean, because another con, like to the internet, is that there's increased competition. So like these online job boards now, like it almost was easier when you could just go in and hand your resume to somebody, but now it's like 10,000 people can quick apply in 1 second.
Yeah.
And it's a mess. But, with technology, things are going to evolve and things are going to change, but there's no going backwards. Like this is just how it is.
Yeah.
So I was curious, what do you think about 20-somethings who are struggling to find kind of the role that work plays in their life? Because there's kind of two mentalities that I see right now, and they're both valid. One is dream jobs don't exist. I don't work to live. I'm just going to find something that just is a paycheck, and come home. It's like what Dolly Parton says, don't be so busy making a living that you forget to make a life.
Right.
You should probably say it with your Southern accent. And then there's the second group where, I think that's actually the majority of people, the silent majority is wondering, how do I find an ideal job? How do I find a job I don't hate, that pays me well, where I feel respected and I can have mobility? So that's what I see most of those two mindsets. Again, the latter is much, much more common. So I'm curious, with 20-somethings, do you have any advice for them when it comes to finding a job that strikes that balance of like the job isn't their life, but it's good enough?
It's important. It's meaningful. Yeah. I mean, people are individuals. So I know plenty of people who say, my work is it's fine. It pays the bills. I clock in, I clock out, and the most meaningful aspects of my life take place outside of work. Works for them. My job is more, work is meaningful. I love my job. I'm like smiling thinking about it. So, I love my work. That for me, that's what I needed to sort of get up and go to work every single day. But, I think like I said before, I didn't love it when I started. I didn't love everything I had to do to get here. Those 7 years at Berkeley were not awesome. But I knew that once I did those, I would have freedom and flexibility and mobility and all kinds of stuff. Then I could set up my career in a way that would have felt better for me. So sometimes, you may not love every step along the way to ultimately have a job that gives you freedom and flexibility and meaning, if that's what you're looking for. And then again, like I said, for some people, they're not looking for their job to be purpose, passion, meaning. They're getting that from family or from other things that are important to them outside of work, and that works too.
Yeah, I think something that people really struggle with is the opportunity cost. So when you're in your 20s, you have time on your side, and it's like, okay, where do I invest that time? That's something that I hear a lot is like, okay, Erin, I could get my master's degree, I could get my PhD, I could climb the ladder at this corporate company, but I have to pick one, and I don't know which one is going to be the most fruitful for me. Should I move to LA and do this? Should I move to New York and do this? When the world's your oyster. And
Right.
you talk about in your new book how to make decisions. So I was wondering if you had any advice for people who are struggling with that.
Yeah, so I mean, I think, in school there are right answers and there are wrong answers, and, you can sort of figure out, like, I learned how to do things the right way and I know how to get A's, and that's very reassuring. And then you get out into life after school and, there aren't right answers, which people really don't like that. The good news is there aren't any wrong answers either.
Yeah.
There are just your answers. And so, I encourage people just to take it one step, one job at a time, and that it will give you data on, do I like this answer that I've chosen? Do I want to sign up for another year or another 2 years of this, or is it time to pivot?
Yeah.
I mean, almost anything that you start, even a master's or a PhD program, or certainly a job with a company, can be changed, after a year or two. So I think on average, 20-somethings have 9 different jobs by age 35.
Wow.
So there's a lot of agonizing over, should I do this one? Should I do that one? Make the best decision that you can based on the data that you have and your realities and needs and values and priorities. And know that it's probably not the last time you're going to make this choice, that you're going to have other opportunities to change your situation.
That's interesting. I wonder if you, therapy is a skewed sample because people going to therapy are going to be a certain type of person. But I'm wondering if you, in your experience, see archetypes of people right now. For example, like the good girl syndrome. Like, I'll have somebody come to me and they're like, Erin, I just realized that I've been living my life for my parents. And I just realized I've never made a decision that was like true to me, and now I don't know what to do. I'm curious, do you see like buckets of different types of 20-somethings?
I'm sure I do. You say that, and I'm thinking, yeah, I can think of 20 people off the top of my head who fit that.
Yeah.
I have not thought before about what are the specific categories, but there are certainly, I think one way you go about writing a book, one reason that, I'm good at writing books is I do well with pattern recognition. And so I see many, many people who on the surface are very different from one another, but there are a lot of common themes, whether it's, I've been living my life for other people, or whether it's, all I've done is work and I don't know what I really like, or the opposite, I'm afraid to do anything, so I'm not going to do anything, and then somehow it's all going to work out for me. So there are definitely common themes, and that's generally what the books are written around. Those are the chapters.
Yeah. Maybe that could be your next book. Archetypes of 20-year-olds.
There you go.
You talk a lot about this thing called identity capital, which is this term that you coined.
I did
didn't coin it.
I did not.
Okay.
I don't like to take credit for other people. It's a guy, James Cote, who's a Canadian psychology professor. He's written some papers about it, academic papers. This is one reason I did not go into academia and write popular press books instead, is because no one has ever heard of that concept until I put it in the defining decade. And then now people have heard about it.
And they credit it to you.
Well, yeah, they do. But I always try to say, no, it wasn't me.
Yeah.
I'm the middleman. But, identity capital there was sort of an old identity crisis model, like from the 50s, where, you go into your 20s and you have a identity crisis and you decide what you're going to do with your life, and then you do that thing forever. It's just not how it happens anymore, for the reasons we were just describing. People have a lot of different jobs. Most young adults end up ultimately in positions or careers they'd never heard of when they were in college. So this idea that college students, when we say, what do you want to do? That's a very limiting question, because they can only answer based on what they've heard of, and by the
Exactly.
time they're in their 30s, there'll be jobs that they didn't know existed, or maybe that didn't exist.
Yeah, my job didn't exist when I was in college.
Exactly. So I never ask a college student, what do you want to do when you grow up? It's more of like, what's next? What are you thinking about next?
Yeah, that's probably why little kids are like astronaut. Like they have like
Right.
5 answers.
Firemen, right?
Yeah.
So many want to be policemen and firemen.
None of them want to be accountants.
Right. But identity capital, what's great about it, it's a very flexible concept, and it's just the idea that the way careers are built is by accumulating identity capital. And so it's investing in yourself, gaining kind of personal assets, degrees, skills, competencies, experiences that will make you, a good candidate to go out and get this job or to get into that program. And then that's more capital, and it builds and builds. So it's very flexible in that your set of identity capital is really different than my set of identity capital. But the idea, what I say to 20-somethings is put yourself on a really steep learning curve, go out and gather all the relevant identity capital that you can, and then you really start sort of cashing it in, for lack of a better word, but using it to your advantage in your 30s and beyond. Probably not in your 20s. I mean, it'll help you get better and better and better roles as you go, but you may not really sort of see the payoff until your 30s.
Yeah, I feel like the 20s is a lot about planting seeds that you'll see grow down the line. That's something else that I see, particularly with Gen Zs who were so hurt by the pandemic and had to be inside on their screens a lot, and they lost out on a lot of opportunity to go out and do the normal things that a lot of us got the opportunity to do because COVID didn't impact high school and college, and a lot of people didn't get to travel abroad in college because COVID impacted their entire college career. So I really feel for them, and I do encourage them now. I'm like, now's the time.
Right.
Go backpack Europe. Go apply for that weird internship. Go do weird things. Go collect experiences and build character.
Well, let me say quickly that I think sometimes people imagine when I'm talking about identity capital, they think like, oh, she means like a desk job or a degree. Not always. My first job out of college I was an Outward Bound instructor, which is, kind of an outdoor educator, and I did all kinds of crazy things. And that, when I went to go back to graduate school, that was what opened a lot of doors for me, because there were countless people who would sort of, put in their time as a research assistant in a lab somewhere, but I mean, that didn't really help them stand apart. So I actually feel like doing more interesting things helped me. That was relevant identity capital for me.
Yeah.
And so it's not always about, work.
Yeah, that's really interesting, because you could have thought about it as, oh, well, I don't have that research experience, so I'm not as qualified as they are, but you spun it.
I did think that.
Okay.
But as 20-somethings do, you imagine like, oh, everybody's better off than I am. It wasn't, I think part of me knew I had to do something interesting. I mean, I wasn't doing something with no identity capital, though it depends on what you want to do, whether anything actually has no identity capital. But I knew it would be relevant. I was working with special populations. I knew people knew what it was. But I definitely thought I didn't have a chance against the people who'd been, working at the NIH and doing their posters at conferences. But that didn't turn out to be true.
Wow. Well, that's a great way to spin that. So I do want to talk about mental health. So the 20-something treatment is specifically about the mental health crisis, of 20-somethings in a way. Something that I was thinking about when I was preparing for our conversation, so I was talking to my husband, and we're talking about this slight linguistics difference that we've noticed between the new generation and like our generation. Although I'm like on the cusp, so I'm one of like the last millennials. I will be 29 this year, and so I'm not like, I'm not saying the kids these days, I'm there. But it's just interesting to see the shift that happened just in the past few years. And I'll get DMs from people saying, I have anxiety around job interviews. But when we were interviewing for our first jobs, we would say, I'm feeling nervous for this job interview.
Right.
And it's almost like people are now classifying feeling anything but happy as a disorder. It's something wrong with me.
Correct.
Instead of, oh, I'm just temporarily feeling this way, and that's okay. I'm feeling anxious.
Right.
That's a big thesis of your book. Can you tell me a little bit more about why you think that? Well, first of all, I don't even know if that's valid, but that was just an observation that I had.
Your observation is on point, is correct. That I think I mentioned earlier when I wrote The Defining Decade, which was quite a while ago now, the first version anyway, I thought about putting mental health in there because I was a clinical psychologist. That's what I do. But my editor was like, nope, nobody wants to talk about that. That's not a conversation for your everyday person. And I remember thinking, well, that's too bad, because most 20-somethings feel like they're struggling. But anyway, that was, quite some time ago. Now everybody's talking about mental health, which is good and not good. It's great that more people are talking about it. What's not been so great is sort of this rush for people to identify with various diagnoses, decide they need medications, without really knowing the upsides and the downsides of both diagnoses and medications. So, what I did with the 20-something treatment is to say, okay, I've been working in this space, young adult mental health, for 25 years. This is what I know about it. This is what the data says. And to try to make the conversation a little more about the data and a little less about the trends or the vibes, which are currently, people describing their problems in terms of the DSM, which is sort of the diagnostic manual. I mean, one really important thing to say about the DSM is that it's not developmentally sensitive. So the criteria, to meet the criteria for general anxiety, it's the same for a 20-year-old as it is for a 60-year-old. So, but your average 20-year-old, it's
going to be more anxious.
It's just normal
because
for them
of the life they're living. Yeah.
Yeah, they're like, oh my gosh, I don't know what I'm going to do. I don't know who I'm going to be. I don't have friends. College is new, or life is new. They have a lot to
anxiety.
They have a lot to be anxious.
But when you're 60, you got it all figured out, right?
When you're 60, you probably shouldn't be that rattled. And if you are,
who am I going to work? Who am I going to marry?
Right. I mean, if you are, maybe you have anxiety. But so anyhow, I really try with 20-somethings to focus on development over diagnosis, and to really emphasize skills over pills.
Why do you think that there is, a sudden trend? I mean, social media obviously makes it easier for people to gain access to, this disorder, and then self-diagnose. But why do you think many people are eager to diagnose? Is it because a label liberates them, and it makes them feel like heard and validated and like they're not weird?
I mean, I guess whether a label liberates someone is arguable, that it can be both liberating and limiting. I think people may feel liberated, but then you can also wind up being limited by attaching your identity to a label, whatever it is, especially a diagnosis. But I think that, the tricky part about being in your 20s are the most uncertain years of your life, as we have discussed. Nothing is certain. Nothing's figured out. There's no structure. And, people are hungry for it. 20-somethings have always been hungry for it. That's why, people love astrology and tarot card reading. I mean, they're looking for anything to say, give me some structure to what is happening. So really, DSM diagnoses, which have only recently become available to the general public, have kind of come into that void and now give people a way to understand of, oh, look, I meet these criteria, this label is what's happening.
Yeah.
Versus, okay, I meet the criteria, but that's pretty easy to do. As a 20-something, why am I feeling anxious? What's going on? What do I need to change so that I can reduce that?
Yeah, it's interesting. I'll be on TikTok and I'll come across a video and it's like 10 signs that you have ADHD. And it'll be like a therapist, she'll have like letters after her name, or he'll have letters after his name. And it'll be like boom, boom, boom. And I'm like, wow, I check 8 out of 10 of those. But it's not because I have ADHD. It's because I'm spending too much time on my phone and the dopamine machine in my brain is breaking. And I know that it's time to put down the phone, take a little cleanse, go exercise, go eat something healthy. But in another universe, I watch that video, I self-diagnose, I get on a telehealth appointment with a psychiatrist, I get, Ritalin or Adderall or whatever it is, and, maybe I even get, in the worst case scenario, get addicted to these medications that I never actually needed in the first place, feel amazing, and think this is how normal people live.
Right.
When really the medication is necessary for somebody to just get back to that baseline. And that's happening a little bit. So what do you think about that?
Yeah, well, a couple of things. I mean, we were talking about diagnoses, and, there's something called the nocebo effect. So the placebo effect is the power of positive expectations. Like, if you think you're going to get better, you're more likely to get better. The nocebo effect is the power of negative expectations, and that can go along with, so you have this diagnosis, and you're like, oh, no, I'm sick. There's something wrong with me. I'm going to have this for life, and or maybe I need a medication to deal with it because I have an illness, therefore I need medication. So the nocebo effect, can go along with kind of tying yourself to diagnoses, which again, it's very easy for 20-somethings to check these boxes, and many of them will not meet criteria for these disorders in 2 years or 5 years once their lives have improved. They'll feel less anxious on the outside, and on the inside they're more competent on the outside, so they're feeling less depressed, they're feeling less anxious. They get better study habits and organizational habits in college, and then, it's like, well, maybe I don't have ADHD, maybe I just didn't have my act together. Now, certainly some people do have those things, but, not everyone who checks the boxes does. The medication piece, medication is sometimes useful and necessary, but it's not always the best medicine for every 20-something. I think not enough physicians, who are the only ones who can prescribe medications, not enough physicians are telling their patients that all medications have upsides and downsides. And so 75% of prescriptions for psychiatric meds or mental health meds are written by general practitioners. So this is not, you are not their wheelhouse. They do not spend all day, every day dealing with people with mental health conditions. All they hear is that, oh, you check the boxes and there is this medication approved for that. Let's do it.
It's a fix. It's just a quick fix.
Let's do it. I mean, it's, partly they're kind of hemmed in on a bad system. They've got 15 minutes for an appointment. The only thing you can do in 15 minutes is write a prescription. You can't, look into what's going on in someone's life.
Oh, I remember that happened to me during COVID. I had an appointment with a psychiatrist, and I was just trying them out, and they were really, really pushing medication on me. And I've always been kind of, researching big pharma. I love documentaries and,
nice.
But I'm also not a conspiracy theorist, guys. Like I'm with it. I'm cool if I needed it. But I was studying. I was just observing how much they were encouraging me. And they never once asked me about family history of addiction, not one time. And they didn't tell me about any of the potential negative side effects. And I think they just barely asked me about other medications that I was on. And I was like, whoa, this is, and I'm like aware, about this stuff, but people who aren't.
Well, it's, I mean, that's, and I mean, it's, we could spend a whole hour on, the upsides and downsides of medications. Very briefly, many people who go on antidepressants, they want to feel less bad, and antidepressants can do that, but they tend to be emotional constrictors. So you'll feel, you feel less bad, but you might also feel less good because they're sort of flattening medications. People go on benzos for anxiety, and they will help you feel less anxious, but they're also addictive, and really shouldn't be used for a long period of time at all. They're second only to opioids in young adult overdoses, many of which are accidental because people mix their benzos with alcohol.
And benzos like Xanax?
Yeah.
Okay.
And then ADHD meds, college students, both with and without ADHD, are taking these. They don't help you develop any better habits. And actually, some super recent data, which did just squeak into the 20-something treatment, they've actually found that if you have a neurotypical brain and you take stimulants to study, you might study longer, stay up longer, work harder, but the quality of the work is worse because your brain doesn't need those. So it's like going into the SAT on like 5 cups of coffee when you normally have 1. That's just actually not what your brain needs.
That's fascinating research. Yeah, it's interesting talking about medication because for some people it completely saves their lives and transforms them, and they truly do have a need for it. And then there are people who maybe don't, and they're very sensitive about it. And so I think it's important to have the conversation, and if this conversation upsets you or makes you feel uncomfortable in any way, I think it's really important to be aware of what you're putting in your body and do your own research and look into it for yourself.
And talk to your doctor. I think that, not enough, I mean, understandably, a 25-year-old, if an older doctor says, take this, they will. So I don't fault 20-somethings as much as what is or isn't happening in appointments. So be sure to ask your doctor, what are the side effects? I'm noticing this, and, just to kind of do your due diligence.
Everything
and be
has
an
side
informed
effects,
consumer.
And you talk about leaning into skills and not just pills. Can you tell us about that?
Yeah, so, kind of a skills over, I'm a psychologist, so I can't prescribe medication. That isn't what I do. I'm not against it. Some of my clients are on medications, some of them aren't. But all 20-somethings, whether you're on medications or not, need skills. So if you have ADHD, and you probably do need stimulants if you have a true ADHD, but you also need to work on your skills. And the same goes for anxiety or depression, that pills don't change anything. They just sort of help your symptoms. So I'm asking myself, what skills is this person lacking? Are they, unsure how to have those difficult conversations at work, and that's what they're feeling anxious about? Or are they grieving a breakup, and that's what they're feeling depressed about, and they're feeling hopeless because of a bad family history of, I think, my life's never going to be good, then we need to deal with that. With ADHD, stimulants can help you focus in the moment, but they're not going to get you out of bed in the morning or help you sort of structure your day, so let's work on that. So all 20-somethings, pills or no pills, need skills, so that's my focus.
I think that's really, really valuable. Some of my content, I focus on before a job interview, things that you can do to feel less anxious, and that includes exercise. There are so many studies on the benefits of exercise to help with anxiety. So I encourage them, call a friend, get a pep talk,
Right.
wear something you feel really good in, eat a
Right.
healthy meal. There are so many, and that's not saying, if you're on medication, don't take the medication. It's just like, do this in addition.
There are other things.
There are other things you
right.
can do that are very helpful.
And, I guess the last thing I'll say about that is most 20-somethings, even if they're on medication, they don't want to be on this forever. So, if you ask a 20-something, is this your plan for 40 years? And they'll say, no, not at all. It's okay, well, great. So what else do you think you need to work on so that ultimately you may not need the medication? That's actually what most young adults want, even if they feel like the medication is useful for me now, but it's not my plan over the long haul. So, it's time to work on other areas.
Yeah, we touched on the thesis of the book, but just stepping back, the 20-something treatment, I guess I would say, is about how your 20s are a very volatile time in your life. Well, you're kind of on an emotional roller coaster. And so is your argument in the book just talking about how to, not be so quick to diagnose yourself in your 20s just because it's so volatile?
Yeah, so the 20-something treatment as a title has a couple different meanings. Part of the meaning is how 20-somethings are treated, in the media, in doctors' offices, where they're often, on the one hand, trivialized as like, oh, they're such snowflakes, what are they so upset about? And then you walk into a doctor's office and it's, you have a disorder, we're going to give you medication. So, like, which one is it? You're a snowflake and you shouldn't be complaining, or
Whiplash.
You have a disorder. So how they're treated culturally is problematic. And so the book is really about how I treat them as a clinical psychologist with a very age-specific approach. So I'm very, very conscious of the context of, well, what's going on in your life that has you feeling depressed or anxious or unfocused or hopeless or suicidal or whatever the case is. Let's put it in the context of your 20s and figure out, what do we need to improve? That generally people's mental health gets better when their life gets better.
And you say that according to your data, life generally gets better. The curve generally goes up as you get older. Why do you think that is?
Because, your 20s are the most uncertain years of your life. The brain does not like that. The brain interprets uncertainty as danger. So when you're in your 20s, you feel like in a constant state of fight or flight, danger. And to put it more simply, most 20-somethings don't have the things that make people happy. So, in some ways you do, of like maybe friends or travel or whatever, but I'm not in my 20s anymore. I have all that stuff. But I actually have the other things that make people happy, like a meaningful job or a stable partner or, kids that are great or, the ability to pay for my travel. And so, purpose and meaning. So, most of the things that we know from the data that make people happy, 20-somethings don't have it yet. They're working toward that, but, there's really no reason to believe these would be the happiest, healthiest years of your life.
Yeah, it's interesting what you said about the brain and uncertainty, because I always tell people that they should be prepared for those couple of years post-school, whether that's post-high school or post-college, because no one really talks about it's the first time in your life that your friends and you aren't on the same train.
Right.
And you guys all get off and everybody scatters.
Right.
And some people will get married and have 2 kids, while your other friend over here is single, traveling through Bali and having the time of their life. And that's just how it's going to be. So you got to be prepared. And I think the thing that we all tend to fall into when we're in our 20s is that we compare our lives.
Right.
And we see that the grass is greener, and social media certainly does not help with that.
Right.
So that makes sense. There's a lot of uncertainty, and it's the first time in your life when nothing is predictable. You don't really have a lot to compare to, or you have too much to compare to. And then as you get older, you get back into that rhythm and that structure.
Yeah, I think as you get, I won't rehash that because you nailed it perfectly. That is the trouble with the 20s. What's nicer as you get older, it's not necessarily that everybody's doing the same thing anymore or is on, but you're happy with what you're doing, so you don't really care. You're not thinking like, oh, I'd really rather be in Bali. You're thinking, well, I could certainly go there if I want to. Right now I'm doing something else, but I could get over there. And so I was just having this conversation with someone earlier today that I think as you get older, you're less likely to compare your life to other people, because ideally you're happy with what you have. And so there's no FOMO.
Yeah, and you've probably experienced more, so now oh, actually I went to Bali and I actually don't like it.
Right.
So I don't really want to go back there. You've learned about more. I think the struggle that I see with people in their 20s, and I think I felt this too, was like, you just don't know yet. You don't know if you want to be a travel blogger. You don't know if you want to be an author. Like, you just...
Right.
The world is your oyster, and that's so paralyzing.
Right. And so it's always, to me, just go do it. Go do something. Whatever it is you think you might want to do, go do it and see if you like it. See if you're good at it. See if it works.
I tell people that too. I'm like, just go do something. Well, lastly, I want to touch on something that we spoke about a little bit last time. You don't really speak about it in your book, but it's the idea of parents. I was talking to a friend of mine the other day who's a life coach, and she runs a program for kind of like, I hate the term like failure to launch, but like parents sign their kids up for this program because they're having a hard time helping their kids get out of the house. And a lot of the kids in the program are like neurodivergent. They're having a hard time assimilating to adult life. And I was talking to my friend, and she's like, yeah, the program isn't for the kids. It's for the adults. She's like, I spend so much time working with parents, and they don't even know that they signed themselves up for my program.
Right.
Because when you look at it, really the parents are enabling the behavior, and the kids are actually wanting the parents to, like, let them go.
Right.
So last time we talked.
Okay. Remind me.
You told me that you have a rule for your own kids.
Okay.
And I don't know if it's still a thing, but you said that they're not allowed to move home after college.
Yeah.
Is that still a thing?
Yeah, that's true. Actually, my son is going to be a college freshman, and he's living in our town this summer in our house. He's just finished high school, and this is it. It's come up not indirectly in conversation. Like I said recently, it was his birthday, and I said, "Oh, let's all do something. Who knows where so and so is going to be next year?" Because it's not going to be here. And I don't think he wants to, so that all works out. I don't think he's going to be crying at a bus stop somewhere wishing he could come home. But we have definitely set the expectation that my kids are going to find work in the summer, go do a job, go do an internship, whatever, but that it's really best if that doesn't happen in our house. And now, for some people, believe me, I've gotten countless emails over the years of, what if I want to live at home? What if I want to live at home and save money? And and I get that, but so I think the question is ultimately not whether you live at home, but how you live at home.
Yeah.
And so, if someone is living at home and they're cooking their meals and they're going to the grocery store and they're doing the laundry and they're learning from the adults in the house how to adult, like you're having a how to adult internship while living at home, I'm all for it.
Yeah.
Probably better than trying to figure out, with your four buddies in your flop house somewhere. But oftentimes what happens is people come home and they revert to old roles. So that 20-something is now acting like a teenager. The parents are treating them like a teenager. Sometimes parents enjoy their kids' company a little too much. I mean, I have two teenagers that are pretty awesome, and I'm going to be sad when they go their way. Sort of. I mean, but doing what I do, I know this is really the best for them.
Yeah.
And I actually make a point of not being too vocal about that because what should happen is they should go on and build their lives and not worry about me. I had a 20-something email me recently and said she was really struggling because she knows she's the center of her parents' universe and she wants to move away. I think she wanted to move to New York and, try her thing in the big city. And I said, I think you need to talk to them and tell them, what's going on.
Got to wean them off you. Yeah, I mean, I get so many messages from parents who are like, can I get my kid to have a meeting with you? I get a lot of those. Can I sign my kid up for I have this thing called the Career Workshop Intensive. It's like a little program, and I'll get lots of emails from parents.
Right.
Like, can I? And I'm like, I say no. I say your kid has to sign themselves up, or else they're not good. It's gonna be a waste of your money.
Right. Absolutely.
Yeah.
That's the light bulb has to want to change.
The light bulb has to want to change. Exactly.
But you know what else? The light bulb has to need to change. And so, to your point of people living at home, depending on the situation, sometimes when we're helping our kids too much, the light bulb doesn't need to change.
I feel like that is such good advice for parents, but it's so much easier said than done for a lot of parents out there, because in reality, when they hear their kid get laid off from a job and they're going to struggle to pay their rent, of course every parent's going to be like, come home. But I remember when I told you that last time, you said, don't say come home. You said, tell them you are smart and you can figure it out. And that was such a mental shift, because it's like empowering your kid versus kind of coddling them in a way.
And also just feeling, it's actually what I was getting at there is not quite coddling as much as panicking and communicating to your kid, like, I don't think you can do this. I don't believe in you.
Yeah, you don't
I
want to do
don't
that.
think you've got it, versus, I think you can figure this out. We're here to support you. And again, if the best way forward is for that person to come live at home, get a job, save some money, then make sure that they're saving their money and not spending it on, whatever, because they don't have expenses, or that they're really learning how to be an adult in the context of the home. But I think I say this to parents all the time, is to, say to your kids, I believe in you. This is a problem to solve. I think you can do it. We're here for you. Rather than like, I don't believe in you. You better come home.
Yeah, I mean, it's definitely been, I think it's gotten a lot worse. I see a lot of millennial parents. It's kind of like a pendulum swinging. I think maybe our parents, like boomers, invalidated emotions, maybe as a result of their parents invalidating emotions. So now millennials are skewing the other way, and they're validating all of their children's. I mean, gentle parenting is a giant trend. And I'm not a parent, but I do have 14 nieces and nephews. So I see a lot of little kids. And all my siblings are fantastic parents. But, you see gentle parenting online where people, get down on the same level as their toddler, and they say your feelings are real. And to an extent, that's great. That's great to be able to validate your kids' feelings. At the same time, though, I really like your approach of saying, but you're strong and you can figure this out and you're really smart. And I was researching, there are so many studies coming out now about teaching your kids resilience and grit, because that will mean that they can succeed and fly away on their own. So I'm curious if you have any advice for parents when it comes to teaching their kids how to figure out things on their own while still, having that secure attachment and being there for them as a parent. How can they balance that?
Yeah. I mean, my first piece of advice for parents is don't panic, that the 20s are a turbulent time. Things will go wrong, jobs will be lost, tears will be shed. But that doesn't necessarily mean there's something wrong with your kid, or that their lives aren't going to turn out. I mean, I heard from a parent last week whose 20-something is my client and has been my client for a while and had been doing much, much better in the last several months, and then woke up feeling not so great one day. And the parent called me that day and was like, they've relapsed. And I said, no, we're having a bad day, that this is not, like, let's not panic and communicate to the kid, oh no, you've relapsed, oh no, one step forward, two steps back. It was more like 10 steps forward, one step back. And so to sort of normalize the full range of emotions, it's very common to feel anxious, stressed, depressed, all sorts of things in your 20s. But to say, okay, well, what's going on? What do you think needs to be different so that you can feel better? To just kind of, rather than panicking, to lean into a problem-solving approach. And that's, kind of the grittiness there of that this is a problem to solve. And I think you can do it. I'm here for you, but you don't need me to do it for you.
You got this. Mm-hmm. Yeah. I love that approach. I think that's really valuable. And yes, I do want you to write a parenting book. So
you do want me to?
Yes,
no,
you should.
No, I'm not going to. Nope. I will not. I'll never write a parenting book.
One day. Well, thank you so much. Is there anything else that you would like to add for the viewers, or any 20-somethings watching this who are just feeling lost and confused?
Oh, well, I mean, I think I'll add, this is both for the 20-something and for the parents of, somebody asked me recently, I was giving a talk for parents at a university, and they were saying, what can we do? And it kind of goes along with the not panicking piece, but this is true for 20-somethings and their families, is to really expect positive growth and change, to have, a growth mindset around young adult mental health, around young adult careers, young adult relationships. Well, none of that is going to be at its best point in the 20s. That this is new, people are going to make mistakes, it's going to be difficult, but that what we know from the data is that generally growth and change works in your favor. And so it's really good news that life is probably going to get better as you go, and that these may not be the best years of your life, and that's okay.
That's great. Well, thank you so much, Meg. This was an awesome conversation. I think the audience is really going to benefit from this. Where can they follow you and support you and get in contact?
Yeah, so my social media manager, who's amazing, is on, and I also read all the DMs. I'm on Instagram at Dr. Meg J. And my books, I mean, I'm a writer at heart. I love for people to read books, listen to audiobooks. So I have The Defining Decade and the 20-something Treatment, are definitely 20-something books. And then I have another book called Supernormal, which is about growing up with adversity and figuring out how to have a better life as an adult than you had as a kid. So that's pretty important for 20-somethings too.
Well, thank you so much for joining us today.
Thanks, Erin. Always fun.